Coming up on News Channel 3 at 5:30, a Charlotte doctor is on the cutting edge with a technique that has already saved a life. Today's health reporter Helen Chickling has our story.
Call her at 570-1333 to win $1,000. Another winning number coming up at 6.
A Charlotte doctor is helping pioneer a new technique that's saving lives.
The device used to repair the heart, and it's now showing promise of fixing the brain. Today's health reporter Helen Chickering is here to explain this, Helen.
The device we're talking about is the stent. Doctors use it to keep clogged arteries in your heart open. Well, now they're trying a new technique. Now a doctor at Presbyterian Hospital is using those stents to repair arteries that go to the brain, a technique that proved to be a lifesaver for his first patient.
Every time my heart would beat, I could hear the swishing like in my ear. It's like my heart was moved up to the inside of my ear.
But it wasn't Darwin Caverly's heart that was causing the swishing. It was the arteries that supply blood to his brain.
My left arm went numb, and also my face went numb. I couldn't talk.
Mr. Caverly was about to have a massive stroke, which happens when an artery ruptures or becomes blocked. In his case, the inner wall of the vessel was collapsing.
And this is what it should look like. This is the normal caliber. But you can see from here all the way down to here, it's very narrow. And as a result, the blood flow through here is very poor. But he was also showering his brain with little clots that were forming within this and being carried upstream.
To make matters even worse, there was more than one artery involved.
All 4 of his were like this, and that's all you have. I mean, there are 4 blood vessels, 4 arteries to the brain, and all 4 of his were like this.
Surgery to fix the problem wasn't a reasonable option. Mr. Caverly was in trouble. This is a tool that helped bail him out. A stent, a device most commonly used to repair heart blockages.
Pass the stent up into this artery, and at the end, this is what it looked like when we finished. And you can see we pretty much have a normal caliber artery, and within 2 days he was better.
While doctors have used stents to fix blood vessels and other parts of the body, they've not been used to do such massive repair work in the brain.
One of those situations where necessity is the mother of invention, we felt like he was not going to have a good outcome if we didn't treat him in some way. And
it's amazing considering the alternative. He came home a week later, and the alternative was probably to go to his funeral a week later. So we're real happy, yeah.
And he's doing great. Now, Mr. Caverly's case with all 4 arteries collapsing is rare, but doctors believe this stent will have a role in treating ruptures that can't be fixed with surgery or medicine. I mean, these people usually died of a massive stroke.
Saved his life.
Absolutely,
Amazing
absolutely.
story.
And he has a few deficits, speech problems and stuff, but he's up and walking and back to work. I mean,
wonderful.
Amazing, yeah.
Amazing
Thanks,
story.
Helen.
Thanks, Helen. You certainly want to stay with us at 6. A pre-Thanksgiving tragedy.